Hello, my name is Pérez García. I'm a licensed medical doctor. I graduated from medical school, Universidad Anáhuac in Mexico City, back in 1982. But I belong to a family, a tradition of medical doctors. My grandfather and my father were two medical doctors. My grandfather started a medical technique back in the early 1930s in Mexico City, a medical technique aimed at restoring the patient's biophysical-chemical condition and restore the health. My grandfather started this technique with good success in many of his patients. Then he continued to administer the technique, and I consider him to be among the very first, or probably the first, licensed medical doctors to start practicing alternative medicine. He was not using medications that he manufactured. He was using common medications that were available at the time. Then my father started to join the practice back in 1954. He was a medical doctor licensed to work in Mexico, and he joined the practice with my father. They both started to treat first infectious diseases, that very good success. Then they started to treat some chronic degenerative diseases and started to treat some cancer conditions in patients in Mexico City, also with good success. And I joined the practice until 1982, when I started to learn from my father this medical technique. Since 1982, I've been practicing medical technique, and currently I'm working here at PBM Centro Médico, and I use these intravenous therapies that complements other forms of therapy to address chronic degenerative disease like arthritis, multiple sclerosis, some solid tumors that can be corrected. My patients need to have an initial evaluation. This initial evaluation consists that the patient sends their recent blood tests and images in PDF format to the email, so I can review and make an evaluation and then respond to the patient if I can give some therapy. That also, with my intravenous therapies, there are other therapies offered here like hyperbaric oxygen chamber, oncothermia, and photobiomodulation, among the ones that complement. Today, patients need to have more than one therapy, especially in serious or chronic conditions. Something in the IV to help restore the terrain, and something on the outside like oncothermia or hyperbaric oxygen therapy or photobiomodulation. And with those therapies that complement, the patient will expect to have a recovery in a short period of time. I don't offer express therapy. The disease cannot be cured in 1 or 2 days, specifically chronic degenerative disease. It takes some time, but at the end, the patients can expect a good result. And for some serious diseases like tumors, they can expect a survival of many years, like 20, 25 or more years. This is all that I do. Thank you.